Avicenna tested over 800 medicines and published them in his Canon of Medicine. He also introduced the idea of quarantine to make sure those contagious diseases that they discovered weren't passed from person to person. Avicenna supported the theory of the four humours, but refined it even further, and obviously used that as part of his treatments in the Canon of Medicine. But he also suggested lots of other treatments, including the removal of veins. Certainly in the Islamic world, in places like Baghdad and other major cities, there were lots of pharmacies and pharmacists that made medicines in their drugstores, and there's some evidence that these were even licensed. Rhazes, in public health, he tried to test where the best place to have a hospital would be by hanging up meat to see where it would decompose the slowest, and figured that would be the best place for a hospital. So they did have public health, they did have hospitals, they had travelling clinics as well, they had lots of hospitals, and they were all free, and they were mainly clean. Here's a picture of one where the doctors would be on call 24 hours using the books and the medicines that have been available to them to treat their patients. Another factor is that the Quran suggested good hygiene, which meant that public health was slightly better than their Western counterparts in medieval times. Finally, doctors. Well, they were trained in the hospitals, and they had to pass tests to become physicians. They used the books, Avicenna's Canon of Medicine, as well as the writing of Galen and Hippocrates and Indian doctors. The doctors are obviously the most famous of the three ones I've been talking about: Avicenna, Rhazes, and the surgeon Abulcasis. But there were lots of others, obviously, in the Islamic world. Okay, let's have a look at the different factors. Individuals. Well, obviously the three that I just mentioned were very important, but there were others. Technology, surgical implements, bone saws, scalpels, etc. War. Islamic tribes are often at war, so they would have developed some sort of first aid surgical procedure, but also the Crusades meant that a lot of this knowledge and writing was taken back by the Crusading Knights to Western Europe, which we will deal with more in the next one, the High Middle Ages medicine, because some of this gets taken back. Chance. Well, because a lot of focus was put on experimentation and trying stuff, then obviously they would have had more chance to discover some of the things that they came up with. Religion. Muhammad himself was a healer, and that inspired some of these Islamic doctors. The idea of hygiene was also an important one. Communication. Obviously a lot was written down, the Canon of Medicine. Arabic was a widely used language, although not everyone in the Islamic world spoke Arabic. It was widely used, and therefore it counted for a lot. Finally, government paid for the hospitals and the doctors in the hospitals. Okay, that's the end of Islamic medicine. Next time it will be the High Middle Ages medicine, when some of this knowledge has been taken back to the Western world.